Good afternoon. Thank you for joining us for this community briefing about COVID-19. Joining me once again this afternoon is interpreter Margie Propp. Thanks so much, Margie, for offering your services to our community. We want to remind everyone to please visit our website at covid19.lincoln.ne.gov. There you will find a dashboard with the latest COVID-19 data, and we update that dashboard each day about this time. You will also find the COVID-19 risk dial, a color-coded tool that gives our residents an understanding of the risk level here in Lincoln and Lancaster County for the spread of COVID-19. And on the dial, red represents the highest risk of COVID-19 spread, while green represents the lowest. For each color, our health team provides specific guidance on all the steps that we can take to protect our health and the health of everyone in our community. We update the COVID-19 risk dial each Friday based on local data, and the health department team has determined that the risk of spread of COVID-19 in our community remains moderate. This means that the COVID-19 risk dial will stay in the mid-yellow range for the third week in a row. We're deeply grateful to all of you who have done so much to help us achieve this progress that we've made as a community to prevent the spread of COVID-19. And we feel fortunate that many who have contracted the virus have recovered. Yet we remain ever mindful that for some, recovery has been elusive, and we have lost friends and neighbors to this pandemic. This week, we lost 2 of our community members to COVID-19. The total number of deaths in Lincoln now stands at 12. And across our state, the virus has now claimed 260 lives. On behalf of our city, I extend condolences to all the family members and friends of those who we lost. We do share your loss and feel grief alongside you. And with the real prospect of future losses and grief in mind, let's recommit as a community to our effort to prevent the spread of this disease. Let's continue to set an example for other cities of what a compassionate and conscientious community can achieve by taking a few simple steps to shield one another from this invisible threat. As we are seeing across the country, this virus is relentless. As our friend Dr. Bill Johnson, the pulmonologist, told us, this virus doesn't negotiate. Still, we have the power to reduce its reach and to save lives if we follow what the former director of the CDC, Dr. Tom Frieden, calls the 3 W's. Wash your hands, wear a face covering, and watch your distance. Keep about 6 feet from others. This is how we will continue to protect ourselves, our families, and our neighbors from COVID-19. Today in Lincoln, an additional 11 individuals have tested positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stands at 1,670. Our total recoveries identified to date remains at 547. To track recoveries, our contact tracers follow up with people 28 days after the date their lab results were first reported to the health department. And if these individuals report that they have recovered or returned to their normal health status, they are considered recovered by our health team. And with a high percentage of our cases having been identified back in May, our recovery number is continuing to rise, and we are so pleased about that. Here now to give us an update on all the indicators and how the position of the risk dial was determined is Health Director Pat Lopez.
Thank you, Mayor. The COVID risk dial has become a useful tool for our community, and many organizations and communities across the country have adopted very similar tools. Our health department team continues to review local and regional data and considers current situations in Lancaster County that may be of concern. No one measure determines what level we are at on the risk dial. It is based on multiple factors. We will again review the 5 key factors that we consider when looking at the position of our COVID risk dial. First is the number of local and regional COVID-19 cases and whether that number is increasing or decreasing. The number of local weekly cases has decreased in the month of June. The 7-day rolling average shows a trend of leveling off, as you can see here. over the past 3 weeks, that 7-day rolling average has flattened to about 17 cases per day. As our overall new case count is going down, there is a different pattern emerging since the beginning of June. Earlier, most of our cases were in working age groups, that is 20 to 39 and 40 to 59. Now we are noticing that the majority of cases are in the 0 to 20 age range and 20 to 39 age groups. Since the beginning of this month, 293 of the 452 new cases have been in the under 40 age group. That's 65%. Just this week, 73% of all new cases are in the under age 40 group. In addition, 25% of the cases are under 20 years of age. Our investigators are hearing that many individuals reported that they went to bars, attended social gatherings, went camping with large groups, or had taken part in team sports activities with no masks or face coverings. This again highlights that all of us need to take precautions to stop the spread of the virus and keep ourselves and others safe. The second factor we consider is the overall positivity rate. As the number of tests and the number of positive test results has leveled off over the past few weeks, we have seen the positivity rate steadily decline from a high of 9.3% in mid-May to 6.6% today. In comparison, the state is at 11.1% and the national rate is 10.3%. A third factor is our local hospital capacity, which continues to remain strong. We have even seen quite a decline in the number of COVID-19 patients in our Lincoln hospitals just in the past week, from 27 patients this past Friday, June 19th, to 21 patients today. That includes 12 Lancaster County residents and 9 from other communities. A fourth key factor is our testing capacity. In the month of June, we have also seen a leveling off of testing, with about 2,500 COVID-19 tests completed each of the past 3 weeks. So far this week, we have received 1,900 test results. This would be on pace for a slight decline from the previous weeks. Despite the slight decline in testing capacity and availability remain good. So we strongly encourage people to sign up for testing if you have symptoms of COVID-19. You can do this by contacting your doctor or by filling out a risk assessment at chihealth.com or bryanhealth.com. The testing is only available if you fill out that assessment and arrange an appointment. Test Nebraska has expanded COVID-19 testing to all Lancaster County residents, including those who have no symptoms. This also continues to be done by appointment only. Test Nebraska will be available in Lincoln next Wednesday, July 1st, and Thursday, July 2nd, at North Star High School from 8 a.m. to noon and 1 p.m. to 5. You may begin the process with a free online risk assessment at testnebraska.com. We are also continuing to offer additional testing with minority populations, particularly for those whose English is a second language. The Health Department will be hosting a free testing event next Tuesday evening, June 30th, from 5:30 to 7:30 p.m. We are especially encouraging members of our Hispanic community to participate in this testing, which is open to all, even to those who have no symptoms. The testing will take place on the south side of our offices at 31st and O. This is the parking lot next to Woods Park. Registration is required and can be done by calling 441-8006 for an appointment time. We will continue to plan these events for specific populations in the future. The fifth key factor we consider is deciding the dial position is the health department's availability to investigate cases. Again, our capacity to conduct contact tracing remains high. We are concerned, however, that the combined circumstances of more people becoming active in the community and fewer people getting tested in recent days could mean that some potential clusters are not being identified, putting more people at risk. That's why testing continues to be so important. If you have been to events or bars, we encourage you to consider testing even if you have no symptoms. Anyone can catch and spread this virus. While our COVID risk dial remains in the mid-yellow moderate area, we are closely monitoring all the indicators so that we can be as prepared as possible to mitigate any surge like the ones we are seeing in California, Arizona, Texas, South Carolina, Florida, and other states. Again, we cannot be complacent. We are all at risk. Everyone needs to limit interactions with people outside of your own household, and we should all assume there is risk of exposure anytime we are out in public space where other people are present. We need to learn from other communities that are experiencing record spikes in new cases, and we need to continue to support each other. If Lincoln is going to succeed in minimizing the spread of COVID-19, we all must follow these steps. Practice physical distancing and avoid crowds of people. Wear a mask or face covering when around others, especially when you can't maintain at least 6 feet of physical distance. Wash your hands regularly and keep hand sanitizer handy. This past Monday, the state-directed health measures moved to Phase 3, which expands capacity limits for most businesses, events, and gatherings. Our local directed health measure was also modified and extended through July 31st. Our local directed health measure does include specific measures for bars and restaurants in Lancaster counties. Employees such as waitstaff and cashiers must wear face covering. Arcade, games, billiards, or other entertainment devices can be played with no more than 8 people congregating, and those areas must be regularly disinfected. Establishments are open to 100% capacity with seating required to be with groups of 8 or less. However, 6 feet of physical distance must be maintained between tables, and individuals will have to continue to be seated unless playing games like pool or darts or ordering food or drinks. For all the latest COVID information and details on how our local directed health measure is enacted, please visit covid19.lincoln.ne.gov.
Thank you, Director Lopez. I'd like to address the under 40 crowd for just a moment. It wasn't that long ago that I counted myself among you, and I can still vaguely imagine how reassuring it must feel to know that you are in an age demographic for whom the impacts of this disease are likely to be less severe. Please do continue to feel fortunate about that. Yet please also consider that all of us in Lincoln, regardless of age, live in community together, just 1 or 2 degrees of separation away from one another. So as you emerge into more familiar activities out in public, please keep in mind that you are at risk of contracting the virus, even if you are at much lower risk of dying from it. And because at your age you are more likely to be an asymptomatic spreader of the disease, you may inadvertently and unintentionally spread the virus to others more at risk than you. Maybe to someone in your family who is older, maybe to a neighbor who is going through chemo, or maybe to a niece with juvenile diabetes. So please keep your whole community in mind as you step out from staying at home as often. Please continue to be a hero in the story of Lincoln's recovery from this pandemic. Wash your hands, wear a face covering, watch your distance, keeping 6 feet between yourself and others, and please stay home if you are sick. Some of you stepping out into public more often are going to be happy about our next update. Today we are announcing that StarTran will resume regular bus service beginning Thursday, July 23rd, and that fares will continue to be free for now. Nearly 7,000 people depend on StarTran every day to connect to jobs, food, education, and medical services. We thank our riders for being patient and understanding of the changes in bus service during the pandemic, and please be assured that StarTran is taking all necessary precautions to provide this essential service while keeping our drivers and our patrons healthy. Here now with more details is Liz Elliott, our Director of Lincoln Transportation and Utilities.
Thank you, Mayor. During the next few weeks, StarTran will continue to prepare all buses for the increase in service. This will include a deep cleaning of buses and disinfection of all buses that have been sitting in storage. We are also installing plexiglass at all of the driver stations to minimize potential exposure to COVID-19. StarTran will continue to conduct social distancing procedures on its buses and encourages the public to wear masks while riding as well. Passengers will be able to board the buses at the front and back of each bus for easy and convenient access. We will also continue to conduct thorough cleaning and disinfecting of the buses every day. Before the pandemic, StarTran was averaging about 69,000 passenger trips per week. As we made the changes necessary to keep everyone safe, I am proud that our staff has also found innovative ways to keep our patrons on the move. One of those ways is our on-demand service, which has assisted more than 4,000 riders during the pandemic. Not only that, the service has achieved a 94% satisfaction rating by our passengers. We will continue to offer this service to those individuals who are more at risk and need to socially distance themselves. We look forward to resuming normally daily operations for our weekday and Saturday bus service and the downtown trolley on July 23rd. You can always find out more information about our schedules and the services at startran.lincoln.ne.gov. Our transit manager, Mike Davis, is also here to answer any questions that you may have today. Thank you.
Finally today, we are so pleased to highlight that through the Community Cares Act funding that the governor has made available, eligible nonprofits and service providers, including child care providers and centers of worship, can apply for grants through the Nebraska Department of Health and Human Services website. And the purpose of these grants is to provide stabilization funds for nonprofits that have sustained a loss of income or increase in expenses as a result of COVID-19, to provide additional support to these organizations that do such important work in our community. Grant windows open up starting on June 29th, and they're actually only open for a short period of time. So we encourage you to go online and apply as soon as you can. More information can be found on the business resources page of our website at covid19.lincoln.ne.gov and at the Department of Health and Human Services website, dhhs.ne.gov/community cares. And with that, we'd be happy to open it up to questions from the media.
Mayor, this is Bill with 1011. I think this one's for Pat.
Okay, thanks, Bill. She'll be right here.
Hi, Bill.
Hi, Pat. I asked the governor the other day if they were tracking asymptomatic cases, and he said at a statewide level they are not. I am curious if you are at the local county level and if you have any idea of the percentage of 1670 that are asymptomatic.
If they're asymptomatic positive cases, yes, we are interacting with them and doing contact tracing. So we'd have to be notified, and then we do follow them. And what was the second part of your question? Sorry, Bill.
That's okay. Just if you had an idea of the percentage of how many of the cases, the confirmed cases here, are asymptomatic.
I don't, Bill. I could ask, but I think the number has been relatively small, to be honest with you. But I'll ask our investigation staff.
Thank you.
Any other questions from the media? Okay, well, we want everyone a safe and healthy weekend. Thanks so much for tuning in to this briefing, and we'll be back next week with more. Thank you.